Hey guys, how are you doing? I hope everyone is doing fine and I'm doing okay. So, surely, I want us guys to discuss something, and there's this main question I want us to ask ourselves. Is Canada healthcare really free? That's a question. So apparently, the time I've been in this country, I've considered healthcare to be free, but in real sense, it is not as free as everyone would think. Generally, there is a cost that you have to go through, and that cost means either your time or some of the situations you're going to go through to access the service. That is the cost you're gonna be paying. So why am I saying this? Because apparently I'm not so much of a hospital going person, and I don't need to go to hospital just because I want. And the funny thing, or something I realized in this country, is people need to have a family doctor, where at least I'm lucky I have one. Some people take even 5 years to get a family doctor. And if you don't have a family doctor, you have to like go to a walk-in clinic. So apparently I used to think like a walk-in clinic you can go to a walk-in clinic just for anything like emergency, because your family doctor is not meant for emergency. If it's an emergency, yes, you can go to your family doctor's hospital, and maybe someone else or another doctor is gonna see you. So apparently I need to have some tests done, and um venturing into healthcare, and some of the requirements for you to have like to work in healthcare is certain tests need to be done prior for your employment. So one of these tests, I need it, and I can't get it without a doctor's prescription, or rather a doctor's requisition. Like I need to get the form to go to a lab to get the tests done and get the results, and then the doctor can give me the results as a proof of the tests are done. So here comes my shock, and that's why I'm like, is healthcare really free? Because apparently, like today, I've been out and about for about 3 or 4 hours, just going from one walk-in clinic to another, because I don't have an appointment for my family doctor. You cannot see a family doctor without an appointment. That is my own opinion, and that is my family doctor. You have to book an appointment, and most likely if I was to call for an appointment, I would get an appointment in a month's time from now. The requisition I need is urgent, not that I'm sick. I just need to prove that I am physically and health-wise fit to work. So I go to the first walk-in clinic, and they're using the health cover, that's the government health card, and then they're okay with it, but it's a walk-in clinic, but I need an appointment for them to see me. So unfortunately they can't see me, and the funny thing, there is no line in the clinic. It's only the receptionist, and they can't even see me. So that was the first frustration, and they were kind enough to give me 2 other contacts of walk-in clinic that I can call to ask if they can see me. So my frustrations began, and I went to the second. I called, and there was a whole list of things to listen to. I was like, I'm done. I go to Google, check another walk-in clinic nearby, and then I go. I stopped there, I walked in, and it's a whole hospital. It has labs, everything inside. I go to the clinic, I sit there, and I wait for the queue until it's my turn, only to get to the reception again. Can I see a doctor? Unfortunately, no, we only see registered clients only. So what is their walk-in clinic mean? It means that walk-in is for their clients only, for their registered members. So this clinic has a database of the members they are seeing, and in case one of their members is ill in between, anytime they can walk in comfortably and get an appointment immediately. Since I'm not a registered member for that clinic, I can unfortunately not see a doctor. So that was my second frustration. My third frustration, I call again for the facility, and the phone number keeps on ringing, and then after they start giving me directions of, if you have an appointment, press this, if you don't have an appointment, blah blah blah, and so many other things. I had to wait for like more than 5 minutes. Unfortunately, the phone did not go through and the phone hung up. I went to another walk-in clinic. It is closed, and it has like restrictions, not like really restrictions, it's like we are open Wednesday for walk-ins from this time to this time. Monday, Tuesday we are closed. Thursday we are closed. Friday you can only walk in to our main facility, which is in this location. So that's a different location from the one that I'm standing outside physically. Guys, if I tell you it's a hassle, it's a hassle. So I go to another facility, that's the fourth one, and it's a walk-in online. I go there, there are so many doors. So basically it's a whole floor of different doctors coming together, like to make up a facility, but everyone is on their own and working on their own schedules, working on their own terms and conditions, and working on their own time. Guys, if I tell you it was a long day, for sure it was a long day. So I stand there, I look at the different doctors and different things they're posting on the entrance, and I'm like, this one is not available, this one takes appointments only. Oh, the only one that was open, I walk in, and guys, let me tell you, if I tell you I was not even ready for anything inside that facility, I'm like, no, I'm done. And one thing, because I know you'll be asking, why didn't I go to my family doctor? The main reason, as I said earlier, is I need an appointment a month from now. That is the soonest appointment I can get with my family doctor. Another thing, my family doctor is way far away from where I am, like an hour plus away. And the traffic, I was not ready to have that traffic, like to go all the way when I'm coming back because of my schedule and time for work. Another reason, I was not guaranteed I'm going to see anyone even if I walk in the facility. It's not a guarantee. So I sat there for like another 5 minutes waiting for the queue to move on. And then I'm looking around the facility and the restrictions inside that room, and they're like, oh, no photos inside this clinic. Oh, you cannot answer a call inside this clinic. Oh, you cannot. And I'm like, okay, all those you cannot are okay. And then I look at the person who was serving, and nobody's even talking. The ones who are in the queue, nobody's moving, and I'm like seated there just thinking deeply. I'm confused, I'm stranded, I don't know where to go next, and I'm like, I want this done before the end of this week. And guess what came in my mind? I'm like, why can't I call my facility? And I'm like, it's not even an emergency after all. I don't know even why I'm stressing myself. So let me call them and find out, can they write to my family doctor that I need this requisition form, and if it's okay, she can email me the requisition form and I can go to a lab, and once the results are out, my doctor can email me back the results. Simple and clear, period. So back to my main question. Is Canada healthcare free? Is it? Another thing I came to realize, when you go to some walk-in clinics that are open and friendly to everyone, like it's open to anyone and everyone, you have to dig your pocket deeper to get the service. Like most of the services are cash fee delivered. So if I need a certain service, I have to top up some money on top of my health card to get the service then. I don't know if that makes sense, because I've seen, I don't know if it's, I don't know, because some facilities will cover that under health card. Some walk-in clinics will not cover that under the health card. So guys, we still stand at, is healthcare in Canada free? What is your opinion? Leave your opinions in the comment section and let's get to interact in the next video. As of now, bye.